Over the duration of this course, I have learned many different skills that I will be continuing to use once I become a nurse. I have found that good introductions are critical to a strong speech. If you start your speech off with a weak introduction, it sets the tone of the speech. Using a quote or even a story will really get the audience's attention. When preparing a speech, it is important to have credible sources in order to back your claim up. If you're just basing your speech off of opinions, it'll sound very unprofessional. It'll weaken and will weaken your speech. As you're preparing your speech, it's important to have a mixture of opinions and credible sources. Including your opinions helps your point of view on the topic become even more clear. Another skill I have learned is to not talk in slang or use profanity. It is important to keep it very professional. I think choosing the right words in a speech is very important. I think that this will help me when I get a job as a nurse. I think that explaining diagnoses will be very hard, especially because I want to work with kids. You have to explain things in a way that they will understand. As a nurse, I think that it will be very hard to not use medical terminology all the time. Granted, you can use it when you are talking to your coworkers and other doctors and stuff, but you cannot use it very often when it comes to patients because they don't really understand it if they're not in the medical field. If you're explaining things in a way that people will understand, it'll really put them a little more at ease about their diagnosis. Staying calm is another important skill I've learned during this course. I think it'll be very challenging having to explain to a child and their family that their child has cancer. You have to be calm and collected so you do not freak the family out even more. Another example of using these skills in the workplace would be talking about treatment options. Even if you consider one of the other options better for the patient, you have to keep your opinions aside unless they ask for your opinion personally. Then once they ask your opinion, you can voice your opinion. Again, it's completely up to the patient in the end. I think explaining each opinion in detail will help them understand more, and if they have questions, always answer their questions. I think the skills that I've learned in this class will also help me to improve my communication skills with patients and their families.